Welcome back to the deep dive. I want to start today by asking you to visualize something. When you hear the phrase healthcare journey, what's the first image that flashes into your mind?
Oh, I think for most of us, it's pretty standard. You picture the clinical setting,
Hmm.
a surgeon scrubbing in, a nurse adjusting an IV drip, maybe that sterile smell of a hospital corridor. It's all very well inside the building.
Exactly. We tend to think of healthcare as everything that happens between admission and discharge. Diagnosis, treatment, medication, recovery. But here's the thing, and it's why we're looking at the source today. That view is incomplete.
It's a huge blind spot.
A massive blind spot in how we think about patient care. And it happens the moment those automatic doors slide open and the patient leaves.
You're talking about the final step, the ride home.
I am. Today we're unpacking a guide called What Healthcare Facilities Should Ask Before Partnering with an NEMT Provider. And just so we're all on the same page, NEMT stands for Non-Emergency Medical Transportation.
Right, and I'm really glad we're covering this because this document, it challenges the way administrators usually look at transportation.
How so?
Well, usually it's just seen as a logistics line item. It's a taxi ride. It's like ordering a pizza. But this source argues that choosing a transportation partner is actually a clinical decision.
Or at least an operational one with huge clinical consequences.
Precisely. That's the core tension here, isn't it? On one hand, it seems so simple. You call a van, you put the patient in, you drive them home. Why do we need a whole deep dive on this?
But the source suggests that if you treat it that simply, you're opening yourself up to massive liability.
Massive liability, patient safety risks, and operational bottlenecks. It creates a gap in the continuity of care. I mean, think about it this way.
Yeah.
You spent thousands of dollars and hundreds of man-hours fixing a patient. You've done the surgery, managed the infection, stabilized them. If you then hand them off to a provider who is untrained or unsafe, and something happens in that 30-minute ride,
All that work inside the hospital is compromised.
it's all at risk. So this guide is essentially a risk management tool. It's a list of questions facilities need to ask to protect themselves and their patients.
And it breaks it down pretty clearly. 4 main pillars.
Exactly. Foundation, the human element, hardware, and process. And the argument is that if you miss even one, the whole structure creates a liability.
Okay, let's start with that first pillar then, the foundation. The source calls it licensing and regulatory compliance. Now, I have to play devil's advocate here for a second.
By food.
Isn't this just business 101? I mean, who hires an unlicensed company? Is this really a hurdle that facilities trip over?
You'd be surprised. We live in the gig economy era, right?
Yeah.
There's a ride-share mentality that has sort of crept into everything.
Sure.
You have plenty of operators who buy a couple of used vans and say, hey, we can do medical transport cheaper than the other guys.
Yeah.
But the source is adamant. NEMT is a regulated industry. Checking for a business license is not enough.
You need to go deeper.
You need to verify they're compliant with specific transportation laws for medical passengers.
And there was one specific standard mentioned in the text that really separates the pros from the, guy with a van.
The ADA.
The ADA.
The Americans with Disabilities Act. This is a total non-negotiable. The source emphasizes that the provider must meet ADA accessibility standards. And this is where the distinction from, say, Uber or Lyft becomes stark.
Right.
You aren't just picking up someone with a suitcase. You're picking up someone who might be in a heavy motorized wheelchair, someone with a fused spine who literally can't bend to get into a sedan, or someone who needs a hydraulic lift.
So if a facility administrator is vetting a partner and that partner says, well, we have a fleet of sedans and one van we're working on fixing up, that's
a stop sign, not even a red flag. It's a stop sign. If they can't accommodate the full range of physical limitations your patients have, they aren't an NEMT partner. They're just a ride service.
And legally, that exposes the facility
to discrimination claims if they can't provide equitable discharge options.
Speaking of exposure, let's talk about money. Or rather, the protection of money. The source dedicates a pretty significant chunk of real estate to insurance coverage.
This is the what if things go sideways section.
It lists 3 specific types: commercial auto, general liability, and workers' comp. Okay, but let's drill down. Commercial auto seems obvious. You need insurance if you crash the van.
Right.
But why does a hospital care about the other 2? Why does a facility administrator need to see a certificate for general liability?
Because accidents don't just happen on the road. Let's paint a scenario. A driver arrives to pick up an elderly patient, just had hip surgery.
Okay.
They aren't in the van yet. The driver's helping them navigate the curb or the ramp. The patient slips and falls.
Oh.
Commercial auto doesn't cover that. The vehicle wasn't moving. That falls squarely under general liability.
And if the NEMT provider doesn't have that coverage?
Then the lawyers are coming after the deepest pockets in the room. And that is usually the hospital that arranged the ride.
I see. So the general liability is the buffer between the hospital and the sidewalk, effectively.
Exactly. And then you've got workers' compensation. This is one that often gets overlooked. Why does the hospital care if the driver is covered for injuries?
I assume it's about the stability of the company.
It is, but it's also about the physical nature of the job. NEMT is not sedentary. Drivers are lifting, securing, pushing, maneuvering heavy equipment and patients.
Right.
If a driver throws their back out lifting a patient and the company doesn't have workers' comp, that creates a messy legal situation that can delay service or, again, blow back on the facility if there are claims of negligence in vendor selection.
The source uses a phrase here I liked. Transparency is essential. Basically, show me the receipts.
That's it. If a provider says, oh, we're fully covered, trust us, but then drags their feet on sending over the certificates, walk away. The source is saying that transparency is a proxy for professionalism.
Okay, so we've established the company is legal and insured. But a company doesn't drive the van, a person does. This brings us to the second section, and honestly, the one I found most compelling. The human element.
This is where the rubber really meets the road, so to speak.
The source talks about driver screening and training. It starts with background checks. Again, standard stuff.
Standard, yes, but very high stakes. You have to remember the demographic here. We're talking about vulnerable populations. The elderly, the cognitively impaired, people on pain medication. You are putting them in a confined space with a stranger. The facility has a moral and a legal duty to ensure that stranger isn't a predator or a reckless driver.
But the source goes way beyond just are they a criminal. It lists specific training requirements that really differentiate NEMT from a taxi.
It does.
Passenger assistance training and healthcare environment understanding. Let's unpack passenger assistance. What does that actually look like in practice?
It's the difference between holding a door open and knowing how to safely transfer a patient. Let's go back to that hip surgery patient.
Okay.
If an untrained driver tries to help by pulling them up by the arm, they could dislocate that brand new hip.
Oh.
And suddenly you have a readmission. The surgery was a success, the hospital stay was perfect, but the ride home caused a brand new injury.
Wow.
Passenger assistance training teaches mechanics how to lock a wheelchair properly so it doesn't tip in a turn, how to secure a stretcher. These are technical skills.
And then healthcare environment understanding. This one sounded a bit academic to me. What does it actually mean for the driver?
It means understanding that they are part of the medical ecosystem. Take infection control, for example.
Good point.
If a driver drops off a patient who has some communicable infection, does that driver know how to properly sanitize the vehicle before picking up an immunocompromised dialysis patient 10 minutes later?
If they don't, that van is just a rolling petri dish.
Exactly. And who gets the blame when that second patient ends up in the ER with an infection?
The hospital.
The hospital. Healthcare environment understanding also covers privacy hypo. Drivers shouldn't be chatting about Mrs. Smith's condition with the next passenger. The source is arguing that the driver needs to think like a clinician, not just a chauffeur.
It really reframes the role. The driver is essentially the lowest level care provider in the chain.
But a care provider nonetheless. That's the key takeaway. They are the last touch point of the patient experience.
Let's move to the hardware. Section 3. Vehicle safety and maintenance. Now, my car has a check engine light that's been on for, like, 3 years, and it runs fine. Why is the source so strict about vehicle inspections?
Well, because your car breaking down is an inconvenience. An NEMT vehicle breaking down is a clinical risk. Imagine a patient who relies on oxygen tanks. They have a limited supply for the trip. If that van breaks down on the highway in July and the AC cuts out and the oxygen starts running low, that is a life-threatening medical emergency.
So maintenance is basically a safety protocol.
It is. The source mentions vehicles must be inspected regularly and properly equipped. And equipped is the key word there. It's not just about the engine.
Right.
It's about the lift. If the hydraulic lift gets stuck halfway up with a patient on it, and I've heard horror stories of this happening, that's a traumatic and dangerous event. The source is saying facilities need to ask, show me your maintenance logs for the equipment, not just the oil changes.
That's a great distinction. It's about the medical equipment that's attached to the chassis.
That's correct.
Okay, so we have a licensed company, trained drivers, and safe vans. But you can have all that and still have a disaster if the logistics are a mess.
Oh, absolutely.
Which leads us to the final pillar, the process, communication and accountability.
This is the operational backbone. This is what keeps the hospital administrator from pulling their hair out.
The source lists 3 communication touch points: pickup windows, delays, and escalation procedures. I want to focus on pickup windows. Why is that so critical to the hospital?
Think about throughput and length of stay. These are the metrics hospitals live and die by.
Right, getting patients in and out, beds.
Exactly. If a doctor signs a discharge order at 11:00 a.m., that bed needs to be empty and cleaned by 12:00 p.m. for the next patient waiting in the ER.
And if the NEMT provider has a vague pickup window, will be there sometime between 1 and 5, that bed is blocked for 4 hours.
Which backs up the ER.
Which backs up the ER, which increases wait times, which costs the hospital a massive amount of money and frustrates the staff. A professional NEMT provider offers tight, reliable pickup windows to protect facility workflows.
That's what the source argues.
And delays. I assume the source just wants honesty.
Honesty and speed. Traffic happens, we all know that. But if a driver is going to be 20 minutes late, the discharge nurse needs to know now.
Not when the driver fails to show up.
Right. If the nurse knows, they can keep the patient comfortable in the room. If they don't know, they might wheel the patient down to the lobby or the curb, where they just sit and wait. That's a terrible patient experience, and it makes the hospital look disorganized.
And escalation procedures. This feels like the in case of emergency break glass box.
It is. And you need to know who was on the other end of that phone. If a driver is a no-show, or if there's an accident, does the hospital call a general 1-800 number and sit on hold?
Ugh, the worst.
Or do they have a direct line to a dispatcher or a manager? The source says clear escalation paths are vital. You cannot be navigating a phone tree when a patient is stranded.
Okay, the final piece of this process section is documentation and accountability. The source lists trip records, incident reporting, performance tracking. This sounds like a lot of paperwork.
Yeah.
Is it actually useful?
It's your legal shield. You know the saying, if it isn't written down, it didn't happen. A professional NEMT operation provides trip records that show exactly when they arrived, when they left, and who signed for the patient. This proves that the transfer of care actually happened.
And incident reporting.
Crucial for liability. If a patient claims they were bruised during the ride, you need an incident report. But it's also for quality improvement.
How so?
If you see a pattern like, hey, driver Steve has had 3 near misses this month, you can take action before a real accident happens.
And performance tracking.
That's how you evaluate the partnership. The facility should be asking, what is your on-time performance rate? If the provider can't even give you that data, they aren't managing their operations. And if they are managing it, but the rate is, say, 70%, you need a new partner.
It has to be a data-driven relationship.
Not just a handshake. The source emphasizes that.
You know, when we step back and look at these 4 pillars, licensing, drivers, hardware, process, it becomes really clear why the intro of the source framed this as a partnership.
Yes.
It's not just a vendor contract.
That is the fundamental shift. A vendor sells you a service. A partner shares your goals. The goal of the hospital is patient safety and efficient discharge. The source is saying, find an NEMT provider who cares about those things as much as you do.
And the source summarizes the benefits pretty well. It says 3 groups win from this approach.
The patients, the support staff, and the continuity of care itself.
And that middle one, the support staff, is huge.
It's so often overlooked. Nurses and case managers are already burned out. They spend half their day fighting logistical fires. If you have a reliable transportation partner, you're giving time back to your nurses. You're removing a major stressor from their day.
Which helps with staff retention and morale.
Absolutely. And obviously for the patient, it means getting home safely to recover.
It validates the care they received. It's the final impression they have of their hospital stay.
It is.
I want to wrap up with a thought that struck me while reading this. It's about the boundaries of responsibility. We usually think the hospital's job ends at the exit door.
Right, once they're off the property.
But this document seems to imply that the hospital's duty of care actually extends all the way to the patient's living room.
That is the provocative question the source leaves us with, isn't it? If you're the one arranging the ride, and you're the one choosing the provider, are you responsible for what happens on the road?
And the trend seems to be pointing toward yes.
The legal and ethical trends are yes. If transportation is the final step of the care journey, then the journey isn't truly over until the patient is safe inside their own home.
It effectively extends the hospital's walls to include the vehicle.
Exactly. And if you accept that premise, then asking these tough questions about licenses, training, insurance, it isn't just bureaucracy. It's a core part of practicing medicine.
It certainly changes how I'll look at those transport vans next time I see one idling outside the ER. It's
Yeah.
not just a ride.
It's a medical procedure on wheels.
A medical procedure on wheels. I like that. That's exactly what it is.
Well, thank you for helping us navigate this. It's a side of healthcare operations that I think goes unnoticed until it goes wrong.
My pleasure. It's always the hidden logistics that make the world go round.
And thank you to you, the listener, for sticking with us on this deep dive. Hopefully next time you think about a healthcare journey, you'll remember to include the ride home.
We'll catch you on the next one. Stay curious.